I would like to welcome Alicia Ibarra-Lemay, who is a student at Concordia University, as well as Sabry Adel Saadi and Mélanie Ederer, who are both graduate students at Université du Québec à Montréal. So with that said, we can go to their presentation.
Hi, and thank you to the research teams at Western University and the University of Guelph and all the partners and participants who made this conference possible. We wanted to start by presenting what Quebec is doing. I coordinated data collection and conducted some of the research interviews. In Quebec, Phase 3 of the Canadian Domestic Homicide Prevention Initiative involves collaboration between two investigators, Myriam Dubé from UQAM and Cathy Richardson from Concordia. Two investigators, two different universities, one Anglophone, one Francophone, one Indigenous person, and one non-Indigenous person. At University of Quebec, there was Mathilde Bourgeois, Marilyn Clairon-Desmarais, myself, and Sabry Adel Saadi. At Concordia, there was Janie Dolan Cake, Autumn Godwin, and Kelsey Brady, as well as Alicia Ibarra-Lemay, who will conclude this presentation. We worked with Quebec, the Montreal Crime Victims Assistance Centre, which was involved in recruiting. Another partner was the Second Stage Housing Alliance, which offered support to participants who wanted it after the research interviews. We had several other partners, including the Association of Families of Murdered or Missing Victims and the Association of Shelters for Female Victims of Domestic Violence. We'd like to thank and acknowledge those who contributed to the research in Quebec, some of whom are present here today. I would also like to take this opportunity to once again acknowledge the courage and generosity of all those who participated in the research. For our team, it was important that the research be done in a humane way, inspired by response-based practice, which focuses on how victims of violence and oppression resist as they try to maintain their dignity, and which takes into consideration the power relationships present in social responses to the violence they experience. The research team therefore paid attention to power relationships and issues that can impact how we function internally and externally. Then, together with those who took part in the interviews, we focused on the social context in which the violence took place, their resistance, and we limited the formal framework as much as possible. Concretely, once the telephone discussion on eligibility was completed, a small kit with a teabag, soap, and a candle was sent to soften the environment during the interview. After the discussion, we sent them another package with a card and some flower seeds and a message saying, "Merci, thank you so much," to continue creating an atmosphere of sweetness and dialogue, despite the fact that everything was done by computer. Also, by lighting and extinguishing a candle, we created a time-bound space to create meeting around this moment of sharing between two people that went beyond the research. According to the comments we received from the participants, these thoughtful gestures were appreciated and allowed us to break through the sometimes cold or formal side of the research, especially since it was done remotely. In addition, despite the challenges of conducting interviews virtually, for some it was reassuring because they could also maintain a distance between themselves and the interviewer by turning the camera on or off and deciding how long the interview would last. In terms of limitations, we found that we reached mostly white, non-Indigenous, Francophone people who were not immigrants. We noted that many of the participants are involved in research or in the field of domestic violence themselves. Their voices are valid and important, but it does reveal that some voices may be silenced by the process, both in terms of the people who make up the team, our recruitment tools, our methodologies, and also the short time frame for recruitment and interviewing. We think this is related to both the context in which services are provided, that Sabry and Alicia will talk about, but also the research environment itself. Also, since recruitment was done during the pandemic, the fact that it was remote was certainly an added challenge. In the end, 26 participants were interviewed, including 5 Indigenous people, 6 racialized people or people who were immigrants, 4 people living in rural areas, 12 children exposed to domestic violence, and 2 people with disabilities. These self-identified demographics are important in order to understand how varied the backgrounds and experiences of the people we met were. So, now that you understand the framework, my colleagues are going to present the preliminary results from Quebec. It's important to mention these are preliminary results and do not do justice to everything the women told us. We're continuing the analysis, so this is only an overview of the process and where we're heading. First, Sabry will present the preliminary results of the interviews with non-Indigenous survivors, including white and racialized women, immigrants, non-immigrants in rural and urban areas. Then Alicia will present the preliminary results of the discussions with the Indigenous participants. Thank you. Thank you, Melanie. Now let's look at the main themes that emerged from this first preliminary analysis. The first theme is police procedures. All of the interviews showed how isolated the survivors were during the episodes of violence. However, the police response allowed a number of survivors to break through this isolation by providing information and referrals to domestic violence services. Several women told us that it is essential to respect the time they need to choose to file a complaint or not, leave their spouse, or go to a shelter. The judicial process was often described as very lengthy and distressing. Survivors agreed on the importance of being supported to help them fully understand the process and prepare themselves. Certain nuances emerged from this theme. Police officers' lack of tact and sensitivity in what they said and did. Sometimes survivors said that the police had stopped or discouraged them from starting the judicial process or filing a complaint. The police talked about the consequences for the children and how cumbersome the process was. Regarding rural areas, survivors report that police response lacks follow-up and consultation. What we can learn from this team is that survivors shared how important it is to focus on signs, attitudes, nonverbal behaviors during police interventions. This leads us to encourage the police to partner with those who are using a more psychosocial and human approach. In addition, all the survivors stressed the importance of knowing their rights. This is even more important for first-generation immigrants, refugees, sponsored women, and women without any formal status who sometimes have limited access to rights. The women also indicated that it was important to respect their history while taking into account the impact of exposure to domestic violence on children during police interventions. Children can be very impressed the first time they're approached by the police and listened to when they talk about the violence their mother and their family experienced. Finally, survivors shared experiences that showed the need for more cooperation between urban, municipal, and provincial police forces and also various domestic violence services. The second theme was the importance of listening. Many survivors spoke of not feeling listened to, not being taken seriously during police interviews. Others said that it was difficult to keep repeating their stories to different organizations, for instance, to local clinics, anti-violence centers, or shelters. Rural survivors compared police response in the cities and outlying regions. In-depth analyses will be conducted. Rural employer support can sometimes be critical to a woman's safety. Respect the statements of children exposed to violence and always put them in context. In other words, take into consideration conflicts of loyalty and the law of silence. The lesson of this second theme is that support, being present, reaching out, maintaining social ties, encouragement, positive reinforcement, consistent follow-ups, are all actions that we must continue to promote in our domestic violence services in order to listen to women and their families. Workplaces can also be a form of support. Developing partnerships and knowledge transfer with workplaces regarding homicide prevention might also be another option. During this preliminary analysis, a few courses of action and recommendations stood out. First, services must be better adapted to immigrant women to ensure a more ethno-culturally focused approach. This avoids misrepresenting immigrant women. Immigrant women shared experiences of poorly adapted services. Some felt stigmatized or misunderstood by socio-legal professionals. It is important to factor in access to the law because the immigration system can be a major obstacle in women's search for help, the help they need to be safe. A second course of action is improving services offered in rural and remote areas. Survivors told us their experience was different due to a disparity between services in cities and rural areas. Services are often too far away, disclosure is impossible in a small community, poor police response. A lack of seamlessness in services can put the safety of the woman and her family at risk. Next, the promotion of outpatient and individualized services in shelters was discussed. Many women believe they must separate to use shelters. Some women reported that admission criteria did not always jibe with the reality of their lives. Shelters are sometimes not adapted to disabled persons, visual handicap, reduced mobility, etc. The last recommendation is to facilitate and promote cooperation between the various police services and domestic violence organizations. Practices may differ between police forces, promoting interdisciplinary work, avoiding working in silos while creating communities of practice, and staying up to date on professional trends or potential ways to help prevent domestic homicides. And now, over to Alicia. Hi, Sabry. Thank you. Hello, my name is Alicia. I'm Kaneka from the Kahnawake community, and I currently live in Montreal. I will be speaking specifically about the interviews conducted with relatives who tell the stories of homeless Indigenous women who they worked with very closely for many years and who unfortunately passed away. We did interviews with a total of 5 Indigenous women who were survivors or relatives, and I will speak specifically about interviews where I was present. Before I continue, please remember that these women faced years of violence, oppression, racism, and the effects of colonization, and that the violence they and their partners faced is only a small part of everything they experienced and survived. It is not the reality of all Indigenous women, nor is it the reality of all homeless Indigenous women. It's only the stories of the courageous and resilient women and their loved ones that have brought us together by sharing their stories to help other women who are going through the same thing in order to help provide more customized services. I also want to say that this is just a preliminary assessment of the interviews that our team conducted. Here are some of the themes that came up in the interviews. The first theme that came up was policing. This was a theme that came up a number of times in our interviews. Often Indigenous women didn't think to call the police first because they feared the stigma and racism that often occur. They also mentioned that when calling the police, usually Indigenous women who were the victims of the situation felt that they had to act like the perfect victim because when they acted aggressively or violently during a violent incident, they felt that the police stopped believing them and started to see them as the perpetrator. It was also difficult for some who had restraining orders against the abusive partner, especially if they were homeless. It's hard to have the restraining order enforced, and that was a particular challenge for these women, the workers who were working with them and the police. Many also said that they felt that the law and the police are not adapted to the situation of Indigenous women, and they're even less prepared to work with homeless Indigenous women. What was said to be potentially helpful was to have more training for police and people working in the justice system regarding Indigenous persons and their experiences with violence, trauma, and the impacts of colonization, so that they could understand the context related to what these women are going through and why they are reacting the way they do. The second theme that was mentioned was housing. It was extremely helpful when working with homeless Indigenous women to trust the women and not be judgmental about their decisions, as Sabry mentioned. Recommendations included having more 24/7 drop-in centers that accommodate and understand the specific realities of Indigenous women. It was also noted that this would be helpful for women who needed a safe space in the middle of the night or just someone to talk to. Another thing that would be helpful would be to have low barrier shelters, specifically with respect to drug and alcohol use. Many shelters have a zero alcohol and drug policy with good reason. But there should be more accommodating shelters, especially for women who have to choose between abstinence and safety. There should be a low barrier shelter that could accommodate and support women rather than throwing them out into the street and back to their abusive partners. Finally, another suggestion was to have a shelter or team of people who specialize in dealing with violence or violent behavior. Most shelter or drop-in workers do not have this expertise or are not equipped to deal with these situations, and most feel that violence gets in the way of helping these women. Finally, an important theme that we heard throughout the interviews was health. They often said that there was a great need for resources for couples counseling services to specifically deal with violence and substance abuse. We need more services and centers in the city that are culturally safe and relevant to Indigenous people. On this same topic, it's especially important to offer services in Indigenous languages. Another important thing was to have services available that come to the women themselves. And finally, we need to implement more risk reduction and holistic approaches. This was mentioned often and repeatedly. Having a holistic approach is so necessary. Instead of just seeing a problem, you have to see the whole woman to be really able to help her. Je voudrais dire également que nous serons à la séance de questions et de réponses après. Nous sommes bilingues, alors si vous parlez en anglais, on sera sur la plateforme européenne en français, mais disponible pour répondre aux questions en anglais et en français. And that ends my presentation. Nya Wingoa, thank you very much.